Telemedicine offers a lot of really great opportunities for the healthcare community, for medical providers. But there's also several important risk management considerations that we have to take into account. The credentialing issue can be compounded with the fact that different states, different jurisdictions have different understandings, different definitions of it. So, one state may have certain requirements for practicing telemedicine that a neighboring state or another state does not. When we're dealing with telemedicine there and care is rendered across those state borders, it can lead to some legal concerns, to some legal issues that we try to resolve through the credentialing process. So making sure, if a provider is going to be providing care across state lines, to at least have some understanding of what those requirements are in the neighboring state where care might be rendered. Trying to ensure that the credentials, that the background of the provider is consistent with where they might be practicing. Another risk management consideration is the technology and the software behind it. Is the system capable of handling downtime? If the system goes down, what can we do to promote the continuity of care? How can we make sure that the results are being transferred? Are backups in place? If the system goes down, how can we make sure we're not losing the necessary information captured? Part of the technology issue with telemedicine is it can happen in a lot of different devices, a lot of different hardware. It could be, the provider's computer with a video conference or video chat with a patient, but it could also be the provider's cell phone. It could be, text messages between providers. All of that can be considered part of telehealth, and from a medical record standpoint, from a defensibility standpoint, we need to be able to encompass or incorporate all of those different methods of communication, all of the information from the various pieces of hardware, making sure it all comes together to promote more or less a unified patient record.